Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
As we get older, we tend to get forgetful, and many people are concerned that this might signal the onset of dementia, such as Alzheimer's disease. But the truth of the matter is, it's often not dementia. Memory problems can be due to a myriad causes. It could be just part of aging itself, a slowdown of the brain, but it could be other medical conditions such as with the heart or the lungs or the kidneys or the liver. It could be some kind of psychological problem, anxiety, depression. It could even be a result of medications. So rest assured, according to the National Institute on Aging, being forgetful as you grow older is a normal part of aging. The brain undergoes many different changes that can make it harder to remember something. It makes it easier to forget things like, where did I park the car? Where did I put my keys? It also makes it a little more difficult to learn something new. Now, the difference between normal aging of the brain and Alzheimer's disease are distinct. There's real differences. For instance, an older person may make a bad judgment decision once in a while. But a person with Alzheimer's, they just have terrible judgment all the time. Their judgment's always poor. Anybody can miss paying a bill. Now, of course, if you're older and you miss paying a bill, it's going to scare you. I mean, it can happen to anybody. But people with Alzheimer's, they're not just forgetting to pay a bill. They're having trouble figuring out how to pay the bill. So there's a huge difference there. So normal forgetfulness, you're forgetting a name or a word once in a while, you blank out during a conversation once in a while. It really is not a serious thing. But there are more serious memory problems, like some people have trouble carrying on a conversation. So if it's progressing and it's worse, it's something called mild cognitive impairment. Now, approximately 15 to 25% of people over the age of 60 have mild cognitive impairment. And this leads to memory problems. There's also a problem with understanding complex situations, like figuring out how to use your new cell phone or the GPS in your new car, or how to use your new controller for your new cable television company. So there's a real difference. There's mild cognitive impairment is beyond just normal forgetfulness and absent-mindedness that you see with aging. And the problem is, now these people could still live at home, they could still go shopping, they could still find their way around. The problem is, these people often drift into dementia. These people have more serious memory problems, and they're much more likely to develop Alzheimer's disease or other dementias than people who do not have mild cognitive impairment. But the thing is, mild cognitive impairment does not always lead to dementia. It depends on what's causing the mild cognitive impairment. In fact, mild cognitive impairment, if it's due to a health condition or a drug, is not even always permanent. So, welcome to my episode, Mild Cognitive Impairment, How to Protect Your Brain. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. I want to thank you for tuning into the Invite Health podcast today. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. Let's get going. Now, there's a Dr. Joe Salinas. He's a neurologist at Massachusetts General Hospital. Massachusetts General Hospital is involved with Harvard. A lot of the doctors are working in both places. He said it depends on the underlying cause for mild cognitive impairment. It's not dementia yet, but it's not normal thinking either. So the most common causes are diseases or treatments for diseases. So like Alzheimer's or other degenerative diseases of the brain, people with mild cognitive impairment can sink into that. But circulatory problems in the brain can lead to mild cognitive impairment. traumatic brain injury, like people who served in the armed forces or they played a lot of football and their head got, their brain got knocked around a lot, they could develop a mild cognitive impairment situation. Medication side effects. But older people that are depressed or they're anxious or they're nervous or they're sleep deprived, they can seem to have mild cognitive impairment, but they really don't. Now, the American Academy of Neurology recently published new guidelines how to treat mild cognitive impairment, because it often will convert into full-blown Alzheimer's or other dementias. And it really depends on the cause. Like I said, if it's a problem with circulation in the brain, or if it's a problem from traumatic brain injury, it's more likely to convert into Alzheimer's disease. So there's evidence linking exercise with improved memory in people with mild cognitive impairment. Now, according to the American Academy of Neurology, they're saying exercise at least twice a week, but you really should be exercising 5 to 7 days a week. First of all, when you exercise, it's often social and it's stimulating. You're probably in different surroundings, like you're outside riding your bike or you're running or you're walking fast or something. But it improves blood flow to your brain. Now, the improved blood flow is obviously supplying the brain with more oxygen and nutrition and calories, everything the brain needs. But it also seems to trigger the release of molecules and neurotransmitters in the brain that help repair brain cells and that foster the creation of new neural networks, connectivity between the organs involved with critical thinking and memory and learning, etc. So there's more to exercise than just circulation, but circulation is a big part of it. They also feel that doing something that's cognitively challenging, like playing a video game or working on your computer or doing puzzles and reading good books, sharpen your brain, but also improve your attention span, your focus. There was a finger trial. It's a pretty famous trial. It was a placebo-controlled randomized human clinical trial. People who had mild cognitive impairment, they had less cognitive decline over a 2-year period if they ate a healthy diet, if they took place in social events. That's very important. That being part of the larger organism is very important for your brain. Exercising regularly. So there are things you can do. There are things you can do if you have mild cognitive impairment or someone near and dear to you has mild cognitive impairment. Mild cognitive impairment occurs in some older people, generally people over 60 or 65. And they have much more problems with thinking and with memory and with learning. As you get older, your risk increases, but so do conditions like diabetes. Diabetes increases your inflammation. Diabetes is a metabolic mess. Everybody looks at sugar, and that's important, but it's also energy production, circulation, inflammation, blood fats. All of these things are off. Diabetes increases the risk of mild cognitive impairment. Being depressed long-term, having multiple mini strokes, because a mini stroke generally affects just a little part of the brain, but if you have 3, 4, 5, 6 mini strokes, there's more damage accruing. It's building up. So all of these things increase the risk of mild cognitive impairment. And obviously the symptoms of mild cognitive impairment are nowhere near the symptoms of Alzheimer's. They're not as severe. For example, people with Alzheimer's, they lose their personality. They have personality changes. People with mild cognitive impairment, they hold on to their personality. So the people with mild cognitive impairment, they're still able to stay home and take care of themselves. They're still able to do their normal daily activities like take out the recyclables or make a cup of coffee. But you'll see things like they're losing things all the time. Where'd I put my cell phone? They might be holding it. Where'd I put my cell phone? They may misplace their keys. They might go to a mall and forget where they parked their car. But also you'll see they're forgetting about dinner date, big things, events, appointments. You'll also see that they're having problems with conversations. Like anybody can have a moment during a conversation where they are searching for a word. But people with mild cognitive impairment, they're having more trouble coming up with words more frequently. More so than you see in people in their same age group. Now, sometimes they may have a decreased sense of smell. Sometimes their body stiffens. They have problems with movement. And there's no specific test your doctor could give you to diagnose mild cognitive impairment. So they looked at all different criteria. Are you declining? over a set amount of time, in mental function, physical function, are they seeing an obvious decline? That's a sign of mild cognitive impairment. Are you having problems planning things, following instructions, deciding on what to do, making decisions? So you're having problems with your memory plus other mental functions. Those are signs of mild cognitive impairment. You're not doing as well as you should be for your level of education or for your age, and your diagnosis isn't dementia. So your overall brain function is okay, but you are suffering. You are having issues. So there's no standard treatment or approved medication for mild cognitive impairment. The diet, better diet. Look at the Mind Diet, by the way. If you want a copy of the Mind Diet, send me an email. My name is Jerry Hickey. I'm a pharmacist. My email address is jhickey@invitehealth.com. The Mind Diet was developed by the Rush Institute over in Chicago. And they put together the best of the Mediterranean diet. People who stick with the Mediterranean diet generally do better physically and mentally as they grow older. And the DASH diet. The DASH diet was developed to lower the risk of developing heart disease and high blood pressure and suffering with a stroke or a heart attack. So they put together the best of the Mind diet, of the Mediterranean diet and the DASH diet, and they call it the Mind Diet. And when the Rush Institute tested it, it really did lower the risk of developing Alzheimer's disease. It really was super, super healthy for the brain. So they don't tell you how much to eat. It's a guide on what to eat and what not to eat. They do give you a couple of tips, like don't have cheese too many times a week, etc., because the saturated fat in cheese is not great for the brain. So they do give you tips. I add my 2 cents on the bottom of that. If you ask me about the Mind Diet, and I'll send it to you, I add my 2 cents, like add some cocoa. Add some green tea, but don't put milk in it, put lemon in it. So I don't have as much XYZ food as they allow with the Mind Diet. You'll be even better. So I refine the Mind Diet, and I also make some recommendations on supplements that are great for the brain. I've been studying these things since the 1970s. So does mild cognitive impairment lead to dementia? How often does that happen? Unfortunately, it depends on what expert you look at. Some reviews say 80% of people with mild cognitive impairment go on to develop Alzheimer's disease. But over a 1-year period, up to 20% of people over the age of 65 with mild cognitive impairment go on to develop Alzheimer's disease. So out of 100 people with mild cognitive impairment, 10 to 20% by next year have Alzheimer's. Over time, 80% of all those people, 80 out of 100 people, will develop Alzheimer's. So what can you do? Well, I'm going to give you some tips right now on what you can do. Regular physical exercise, really important. A diet low in saturated fat, like the fat you get in steak and lamb and veal and butter and cheese, but very rich in fresh fruits and fresh vegetables. Beans, nuts, seeds. I mean, the best nuts, walnuts, pecans, almonds, they're probably the best nuts. Pistachio nuts, because they have lutein in them. Fish oils. Now, the Mayo Clinic said, hey, fish oils, take your fish oils. Good for the brain. Intellectual stimulation. Being social, it's a good reason to go ring the doorbell of your neighbor and introduce yourself. Social engagement, playing cards with people, playing chess with people, just having conversations with people. Very good for the brain. And then there's all these memory training exercises that you could get on the internet. I don't know the value of them. Some of them seem to be helpful. But food, supplements, very important. So here's a report on green tea. Green tea intake and the risk for dementia, Alzheimer's disease, and mild cognitive impairment. What I'm going to do, because I'm going to say a lot about supplements, I'm going to end our conversation, the first part of the conversation here, and I'm going to have part 2 of this podcast, supplements and foods that are really great for the brain. That's what I'm going to do. So thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and please leave us a review. You can find us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you next time on another episode. In fact, part 2 of this episode where I talk about nutritional supplements and mild cognitive impairment. And thank you so much for listening today.